Dr. Kevin DiBenedetto joins us right now. He is with Lake After Hours. And, Doctor, we appreciate some time with you this morning. I understand you guys have been mostly slammed ever since you managed to get your doors open again, huh?
Yeah, we've been really, really busy. Our hours are a little bit shortened because of the getting the employees there and with the curfew and stuff. So we've been packing in a large amount of patients in a shorter amount of time, but we've been running them through pretty quick and got enough locations open where I think we're helping out a good deal.
What are some of the most common things you're treating people for?
The things that I've seen the most have been several cat bites, believe it or not. I guess people rescuing.
Cat bites?
Yeah, rescuing animals, and I think they get scared, frightened animals, and they just reach and grab them. And I saw 3 cat bites in just one day, which is really, I've never had that happen before. But that sort of thing, animal bites, a lot of insect bites. A lot of insect bites are getting infected and getting some boils and stuff. Seeing a lot of puncture wounds, a whole lot of puncture wounds, people walking around in the debris and stepping on stuff and not, wearing the right foot gear and not even seeing what's underneath the water has been an issue with several people. We've seen a lot of falls. I've had to sew up several people with lacerations. We've seen some broken bones and a lot of sprains and strains type stuff from the cleanup efforts.
Doctor, when you talk about cuts and punctures, I'm thinking with all this funky water, what about tetanus? What's the risk there?
Yeah, there's definitely an increased risk of the tetanus. So we've actually ordered quite a lot of extra tetanus, and we've had some people come in just to get a tetanus shot, and because you're supposed to get one every 10 years, even if you do not have a tetanus-prone wound, just to keep your immune level up. So anybody that's getting a cut and open wound, certainly dealing with the flood water, should get up to date on their tetanus.
I was also thinking about dehydration, exposure. Are these factors that you need to worry about during these times of catastrophe?
Yeah, actually, that's true. I had somebody yesterday I had to give IV fluids to because they were dehydrated. I think people they're getting into their houses and they're doing as much work as they can as fast as they can do it, and don't realize that they're overtaxing themselves and the conditions and not drinking enough fluids and are taking enough breaks because they're in a hurry to knock down walls and get out wet carpet and don't even think about, because they're indoors lots of times, they think, oh, well, I'm not going to get dehydrated, but actually they are, and that's one of the things you need to be concerned about.
Doctor, you talked about cat bites. The other kind of bites that, when we have these flood events, spiders and snakes. I hate to sound like an old Jim Stafford song, but yeah. Spiders and snakes. Have you been seeing snake bites or spider bites?
Lots of spider bites and bites that a lot of people think are spider bites. It may be some other insect. A lot of poor spiders get a bad reputation out there because a lot of these methicillin-resistant staph infections that turn into boils, people think they're spider bites, and lots of times it can be any insect bite that allows that staph bacteria to penetrate the protective skin barrier and get in there and cause a boil or an infection. But a lot of people reporting seeing a lot of spiders, unfortunately. Lots of ant bites. I've seen a ton of ant bites because they're floating in the debris and people getting in the water, and the ants cling to them, of course, and bite them. So I've seen several people coming in with those and a lot of swelling if they're allergic to them. I have not seen any snake bites up to this point, but that is something to be concerned about because they're going to be looking for dry area and they're going to be looking for food. So you need to just be careful about where you go and keep your eyes open.
Doctor, I know your time's valuable, and I'm going to let you go. I just want to ask you one more question. The Lake After Hours clinics, how many are open right now, and where can people find them open?
Well, I tell you, we've managed to get every one of them open except the one in Denham Springs because it took on a lot of water, but the ones in Zachary, Central, Perkins and Drusilla, Highland and Lee, Bruley, O'Neill, Hammond, they're all open 9 to 6 right now. We're hoping to expand some of those hours to 9 to 9 tomorrow. Probably not later than that due to the curfew and getting employees there, but we're open at every one of them except for the Denham Springs. And out in Ascension, I think the one on Highway 73 and Burnside in that area is now open also.
So, and these are walk-in clinics, no appointment necessary. Wait time, from personal experience, I can tell you wait time is minimal. Of course, they may be a little busier in this emergency, but Dr. Kevin DiBenedetto with Lake After Hours, thanks so much for your time. I know you're very busy. I'm going to let you get back to it.
My pleasure.